slide that I put up. Oh, now I can see that it's being recorded. What you can see there on the slide that I put up is a QR code, and if you want to get a copy of the slides, just use that QR code. It should take you to a copy of the slides. And if that doesn't work for any reason, tell us and we can pop a link to them in the chat. So this is about gap finding and trying to work out how you fill those gaps in knowledge. And I guess I put a picture of a wall up there because oftentimes many of you people have probably done house renovation where you've used gap filler to find gaps in walls. And this process of what are the gaps in knowledge and how do we fill them can be a similar sort of exercise. That's probably my first bad dad joke for today. Okay, so I too would like to acknowledge the traditional owners of the lands on which we're meeting. This is a wonderful piece of artwork commissioned by Sydney Local Health District and shows the Bedigal, Wongal and Gadigal lands on which the health district is based. And I'd like to say that these lands were never ceded. These lands always will be Aboriginal lands. I'd like to pay my respects to elders past, present and any emerging leaders here, and acknowledge any other Aboriginal Torres Strait Islander people in the audience. So I think Katie said all these things, and I guess one of the fun things that I've been doing for the last 4 years is working in a fun role between the university and the local health district to try to work out how do we get research translation. And the brains trust for that for me was stuff that I'd worked on for years in evidence-based practice. It's trying to understand implementation science and using Sydney Health Partners as a bit of a kind of a resource in that space. So one of the things that I wanted to really talk to you about today was getting research priorities. Why would you want them? Why do you need them? What are the benefits of them? And how do you get them? That's really the essence of what we want to get to today. So just a second bad dad joke is to remind you about Douglas Adams and the Hitchhiker's Guide to the Galaxy. The answer to everything is 42, and that's probably because we didn't ask the right question. So in order to get the most out of research in health systems, we actually have to know how to ask the right question. I guess I was joking around with some other people about 10 minutes ago and said, look, we could say that this is like that wonderful Casey Chambers song, if you're not pissed off with the world, you're not paying attention. There's a lot of things we could do better. We do have a pressing need for better answers to questions across the board in our health services and in our drug and alcohol and mental health services. In that sort of context, we've got limited resources in terms of our actual health services and drug and alcohol and mental health services, but also limited research resources. We also have lots of waste. There's lots of research that goes on that doesn't actually make much progress. Fair enough. We don't want to stifle innovation. We don't want to say that everything has to be showing benefit next week. But equally, we do need to be able to focus in on things that are a benefit next week. Now, just see there's somebody in the chat. There we go. Showing your age being a Douglas Adams fan. Oh, that's good. Right, and I think one of the things we do know is that, well, there's a possibility that if we have a better sense of what our research priorities are for a health system, for a health service or a drug and alcohol service or a mental health service, then there's a greater chance that there'll be an answer for those needs and those. So it's about asking the right question, and I think, and having some questions ready. Maybe could I just get, because this is a webinar and we've got, how many people have we got? 20 people here. Okay, we're a relatively small group. This is fantastic. Could I get you to jump onto Slido? I hope you've used Slido before, but if you haven't, there's 2 ways you can do it. You can use that QR code that's there on the screen, or you can take your web browser to slido.com and put that number in. And there's a spot there for you just to type a few words, if you'd like to, about what you want to get out of today's workshop, just to give me a bit of a sense. Someone's typing. Thank you for doing that. 2 people are typing. That's awesome. 3 people. Thank you. We should start to see the answers in a minute. Right, an overview of how to use research in practice, cool. Particularly how to ask the right question, I think is what we're on about today. 6 people, 7 people. Oh, you guys are awesome, thank you. Just pause a little, wait for those answers to start coming in. To hear your pearls of wisdom. Oh, well, I think they're really other people's pearls but anyway, thank you for that. How to access research and put it into practice. I suppose the big message for me is that by knowing what it is you need to know, you can be a better partner with researchers. So, yep, something about qualitative data, absolutely. Right, a broad research agenda. We want to narrow it down. I think that's pretty reasonable, and I think one of the ideas for me today is that people will have different amounts of resources to be able to put towards their research agenda, and having a research agenda is better than nothing. Having a more specific set of research questions you want answered to is probably going to be more likely to get you those answers. Right, when to do an evaluation, when to do a formal research project. Yeah, and I think that's probably mostly about the resources you've got. So there's a whole lot of interesting questions there. I think we'll answer some of those, but let's see how we go. There's one more person typing. I'll just wait. Thank you again for jumping in and having a go at this. And if we don't get to this ethics requirements, oh my goodness, I'm not quite sure how much we're going to touch on ethics requirements, but maybe Katie and I can have a conversation about some of these things and make sure if we don't cover it today. So I might go on to the next slide, or there's someone else typing. I'll just wait for this last. Maybe not, that's not coming through for me. All right, I might move on then. We do have an opportunity to cover some of these things, but now I've lost my cursor. Where are we? Come on. Okay, so what are research priorities? And I guess sometimes we might want some starting points. 2 starting points you could look at if you don't have anything is to look at the National Mental Health Research Strategy. This is a research agenda and a set of research priorities for the whole country that was released last year by the National Mental Health Commission with an exhaustive consultation process leading up to it. You'll also see the New South Wales Health has a prioritisation framework for alcohol and other drug research that's a 2020 to 2024, and that framework ties to some grant money that New South Wales Health has. And the 5 priorities that are in that document are about evaluating current models of care, getting access to and getting access for people and the journey that people have through the system, improving services for priority populations, looking at mortality related to alcohol and other drugs, and prevention and early intervention. Now, what you're getting from those priority areas is a fairly broad statement about what the ministry wants. It's not really saying my service should do this piece of research at this time. And I think really these are a starting point. What I want to show you now is what could the end point look like. So if you've done a very fancy research prioritization process, and I guess if you're interested in this, the James Lind Alliance in the UK has a very nice way to set up research priorities in consultation with end users and different stakeholders and people with lived experience to then say, okay, these are concerns that people have who are stakeholders of our services. Are those concerns already addressed and it's just a question of getting dissemination, or is it actually a knowledge gap? If they are already addressed, were the answers very old and we need a refresh? And in which case, then can we take them down to really phrasing them in a very practical and clear way so that they might be answered. So here, for example, is what I've got on the screen there is the James Lind Alliance research priorities setting partnership results for alcohol-related liver disease. And you can see I've given you the top 10 there. It's not a bad idea to follow that link and have a look and see what the others were. And you're getting a sort of a sense of a bit more detail. So research priorities like this probably are a bit more clear for how you might address them, how you might answer them. They obviously take a bit more effort to get to. So I suppose I just wanted to give you an idea of what would be the most you could hope to achieve in a research priority process would be something like this. This takes a fair bit of resources and it's done in partnership with others. So I think as an individual agency, I wouldn't really be expecting you'd get to this point. I think this would be something that you join in a partnership with. So one of the things I try to get a sense for is what are the burning issues at the moment for people? And I suppose in my work, one of the burning issues is really about, here we are, hopefully in the tail end of this pandemic, definitely dealing with the waves of impact of the pandemics and the social and economic impacts that we're having, particularly in health services, then workforce shortages, levels of disengagement and levels of burnout. Obviously, those have been issues in the past. Here's a wonderful NADA special edition on this issue from September 2018. It's not a new problem, but really the pandemic has made this worse. So what do we do if we're facing the next couple of years of trying to do workforce retention, trying to deal with burnout? Is that a potential research priority? So I'll use that as an example as we go through the rest of the slides. So what we've done so far is talked about what research priorities might look like. I've used an example to kind of help illustrate that, but let's spend a bit of time now talking about why you might want them. I guess I've tried to make the case that we do have a pressing need for better care. Research efforts and research funding are scarce. There are gaps between research and practice, and the more likely it is that you have your own research priorities, the more likely it is that they're going to be answered. I think one of the things I've tried to, the aspiration for me is that people are able to develop deep relationships with researchers. Now, you probably had in the past relationships with researchers which have been more transactional. You give them participants, they might give you something back. That's a very transactional, superficial relationship. The question that's being answered is probably the question that they thought up, and it fits their research agenda. On the other hand, you might hear mantras like no survey without service. So we start to see a pressure for some sort of a deeper engagement between researchers and services to try to answer what are their shared needs. So as I say, this is an opportunity to come up with to support a deeper relationship with researchers. The more sure you are of what it is you want to know, the more likely it is you're going to be able to be an assertive partner in a relationship with some researchers. So you could say, oh, well, why don't you need research priorities? Because this all sounds like a lot of work, and shouldn't we just get down and answer the questions? We don't have to make it perfect. Let's get on with it. I think that's a reasonable thing to think through. This isn't the we've got to be careful. We don't build up a perfect set of research priorities and then have nothing to come behind it. Okay, one of the drivers for this is work that Paul Glasgow and Chalmers did in the 1990s. They came up with an estimate that 85% of health research was wasted. And then they've come back to it in 2018 and really just checked, people argued with them. Oh, yes, this bit here is more important than that bit there. Oh, yes, really, it should be 2% there, not 3%. And they basically said in 2018, look, we're pretty right. It's about 85%. So how do we get to that answer? There's a significant proportion of research that asks the wrong question, perhaps because it's already been answered. There's a significant proportion of research that uses methods that don't actually come up with an answer. So the design is poor. The study is underpowered. Even though resources were spent, it wasn't likely to be a definitive result. There's a whole lot of research that gets done and no one ever sees it. The results aren't known, so that practical implications can never be acted upon. And one of the things that Paul particularly has emphasized is that even when research is published, it's expressed in a way that no one knows what to practically do with it. So I think that's really telling for why we need to make sure that we're asking the right question. You might see, you've seen things like this, that it takes 17 years to take a discovery into practice, and the kind of reasons for that. This is across all of health research, and the real value of trying to span this gap. So how do we span this gap? And I think making sure that that we know what are the pressing problems for health services is really one way to help make this work better. So another way to think about this is a slide that comes from Sally Green from the Australian Cochrane collaboration. You know, it's really saying we're quite good at producing evidence. That's sort of knowing what we need to do. We understand a bit more about how to translate and implement that evidence. That's doing what we know we need to do. We're not too bad at auditing and quality improvement, measuring practice. So knowing we are doing what we know we need to do. But the point for today is really knowing what we need to know. What are the gaps? So that's one way to think about what we're trying to do here. So what are your options? It's easy to start off by taking on someone else's priorities. That doesn't require much work. One thing you could do that's a little bit more work is to adapt those. It's possible to develop your own priorities, and there are ways to do that. I really would recommend the James Lind Alliance process. Part of this also depends on what your service, what your agency wants to achieve. Does it aim to make new discoveries? Is it okay turning other people's innovations into practice? Or does it really take the view that there's nothing more to be discovered, that we know everything, we just got to do it? All the work's already been done. Probably if your agency took that last view, I think you probably don't need research priorities. I think you might need another place to work, but that's another story. Some of this is also down to how much time and effort and funds do you have. So regardless, I think going through this process, taking a pause today to think about what your research priorities are, I think is a useful thing to help you to be a more assertive user of research. Another resource that I put you to is this sort of idea of, as we've sort of talked about, gap finding, I should say. And the Campbell collaboration is an agency, an international collaboration that works on the idea that we want evidence in areas where there are gaps. So one of the things that you will see is quite nice evidence to practice gap maps, a bit like the fantastic announcement on tube stations, mind the gap. Don't know if I did a good impersonation of that, but this way of demonstrating the gaps is quite a useful thing. I will show you an example of that. So what do we do? One of the suggestions for how to find your own knowledge gaps is to start with things that you're uncertain about. And this can be a bit of a jump, because a lot of times we spend, I do this myself, we try to give people hope, we try to give people certainty, we try to give people containment for their concerns, and we may sometimes overstate things, our expert opinion. The idea behind this process is to start with what we don't know, start with where we're uncertain. We can do that by thinking about clinical variation. So it might be that you've got some idea that there are some people who have a very different journey through care with you. What's going on there? Why is it that people have a different journey through care? What are the features that make it different? Why is it that the people with these features have a better result, and these people with these features have a worse result? What's going on? That kind of uncertainty. Another place to collect up uncertainty is to collect up the kinds of questions that people ask, maybe in supervision groups, or where consumers ask. Sometimes it's also in paying attention to sentinel events. So it might be that when bad stuff happens, you might have some process of root cause analysis that might unravel or unveil some uncertainty. So what is it? What we're trying to get at here is, what is it that you need to know that you don't know? And the kind of barrier here is usually around, we spend a lot of time trying to be more certain to give people confidence, whereas acknowledging what's not known is important. So I just, maybe from what we've said so far, is there something, maybe one thing that you're thinking about that could be a research priority? It could be a question, it could be an unknown. Would you like to have a go at just writing that down? Now, feel free to write it down in the space here. Perhaps for your own purposes, if you don't feel comfortable to put it down on the Slido, just write it down for yourself. Have a go at what would be a research priority you think for your agency. I'm hoping at least one person might stick in something public. So at least we can have a talk about their example. Oh, that's good, thank you. How to retain staff. Yeah, okay, that's picking up on that. And you're doing it in the chat, which is perfectly fine. How to retain staff, right? I think that's something that I've kind of got some things prepared for you to work with. So I'm happy with that example. Come back to that again. Authentic co-design, which actually moves to translation. Okay, how can volunteers make an effective contribution to AAD services? Cool. And oftentimes when you talk about authentic co-design, I'm guessing you mean with people with lived experience rather than with other stakeholders. So I'll assume that's the case. Outcome and impact measurement, monitoring and evaluation of services. Okay. You might want to think with that one, is it about research on what is the best way to do that? Or is it that it's a QI exercise that you're talking about? So it's an important thing to do in order to show, uncover a model or process to integrate lived experience within the system. I think Katie's got a really good co-design Kickstarter pack that I think we've got a link to on the next, on a couple of slides coming up. So some methods of co-production and co-design there. There's one more person typing. I'll just hold on while we do that. Okay, well, here we go. Restaffing shortage, how to ensure that staff are appropriately trained within the organization. Okay, so that could be a question of what's the best method to get training to people. Cool. There's some great ideas to get us started. I'll try to keep them in mind when I'm talking on the next couple of slides. And there's another one that's in the Q&A. In our LHD, where and how consumers, family supporters are engaged in research, enablers and barriers, which will identify gaps. And okay, I don't quite get that one, but maybe we can come back to that. All right, so let me go on to the next. Oops. So one of the strategies that's often proposed is that we want to try to ask a question, turn a research priority into a question that could be answerable. And one of the strategies to do that is to use this acronym PICO. So it's really saying that there are 4 elements that we need that could go into a question to make it more likely to be an answerable question. What are the characteristics of the patient or population or the problem? What's the condition? What's the Now, this comes from a reasonably medically oriented space, so the language is a bit focused in that way, but I think it still has some interesting, useful features. What is the intervention or the exposure? What's the procedure? What's the process that we're talking about? That's the I, the I in PICO. And because we're often talking about making real choices, what is the comparison? What's the alternative that we could be doing? So if we don't have an alternative, sometimes it's really a question of, well, what's the knowledge gap? There's no alternative. We just do the thing for which we don't have any alternative for. And what's the result? What's the outcome are we talking about? So can try to put questions in to this format, and that might help to make them more answerable. So in trying to do that, we can then check if that question has already been answered. And one of my favorite tools, there are lots of different tools out on the web. Some people get like using PubMed. I quite like using Trip. And so I've taken the example of how do we prevent burnout in health professionals who work in a substance use field, and I put that into the PICO search part of the Trip database. You can see, I might just change my pointer. So hopefully you can see here in the P for PICO, I've put health professionals substance use. Now, when I put that in, I was thinking, oh, actually, is this going to find me studies about health professionals using substances? It hasn't done that so far. I've left the intervention blank, and as I have left the comparison blank, and I've looked at the outcome being burnout. So, one of the things that's popped up pretty quickly, one of the nice things about Trip is for quick searching is that it gives us these evidence-based synopses. So it's, in a way, has someone else done the hard work? And interesting review, an evidence-based synopsis that comes from the Ontario HIV network, burnout among substance service providers addressing substance use disorders. So I can click that link, and that's what happens here. They've told us the questions that they were looking for when they did their evidence-based synopsis. What are the sources and consequences of burnout among service providers addressing substance use disorders? Okay, so we get a sense of some elements of PICO in that question. So sources and consequences of burnout, I guess, are the outcomes. Service providers addressing substance use disorders are the patient group. What interventions have been implemented to manage the impact of burnout among service providers addressing substance use disorders? So I suppose they're quite good examples of research questions that are quite well formulated. It's kind of easy to turn that into a search. And then just for interest, because I was kind of interested in this, here are their key take-home messages. Obviously, this is a very quick jump into this, and if you're going to make some serious changes into your service, you need to go in a bit more detail, but just to illustrate how this might be done. So the key take-home messages from this review that was done, you can see them here. So here are the sources. This is the experience of burnout. Here are the sources of burnout and the kinds of successful interventions that have been put in place. So I suppose what I wanted to get you to think about is really what do nicely framed research priorities look like? And these kind of research priorities here have some of the features that help with that. Okay, so the next thing that's a bit hard to answer, particularly if you've not done a lot of research, is to know ahead of time how likely is it that you're actually going to be able to answer that question. A lot of people will ask questions for which the research methods are really hard. You need large samples of people, and so oftentimes we're getting a bit of a cold shower at this point and saying, okay, that's a good question, but there's no way we're going to be able to answer that. And trying to come up with a set of answerable and pragmatic questions, the things, I guess, that will make a difference to your service next week, next month, not the kind of things that will might deliver an answer in a couple of years. So can the key parts of the question be specified and defined? So can we take the parts of the question and turn it into something that we really know what we're talking about? We can obviously make mistakes there. And one of the common things we see is that people will pick up an easy to use index of an issue and then get stuck in what that actually means. Is there a timeline that's feasible? Do you have the resources to carry out a study? So this is kind of saying, don't start something unless you can finish it. Kind of keep an eye on the end game, anticipate the end game. Now, for example, if we're trying to retain staff, it might be that we say we're going to do a survey of staff and ask them in that survey, what's your intention to stay in the organisation? So actually that's what happens across the New South Wales government. There's a survey that's called People Matters. And one of the questions that's in People Matters is, how long do you intend to stay in this organisation? And that becomes the most widely used index or measure of retention. Obviously, there's some twists in that, and you might want to think for a minute, what's the danger of doing that, particularly if it's a survey for which there is pressure to complete that survey. So do people give us an honest answer? The other thing I suppose you might want to think about is actually intention to stay, when we're talking 12 months ahead, doesn't take into account changing circumstances, doesn't take into account that some people are just going to get pissed off and leave. So the next question for us is, having come up with a question that's relatively specific and defined, is it actually answerable? I think one of the next things I'd like to suggest is playing it through to the end. So often when I talk to people about doing research in health services, it's like actually what they want is they want the research to be like a big hammer that they can go and take and beat someone over the head with so that that person makes the right decision. And it seems to me that probably that's a nice idea, and I wish the world worked that way, but I don't actually think that's the case. So I often try to ask questions like this. Play it through to the end. You've got the result. What's going to happen? Who is it that you're trying to convince with this result? Who are the stakeholders here? And what is it, in fact, that will convince them? Have you actually talked to those people and said, okay, what would you need to know to make this decision as opposed to that decision? Too many times I see people coming along and saying, a really careful piece of research that's lots of effort, and actually this is something that a lot of researchers do, they overshoot that. I spent a lot of time during the pandemic talking to people in health services about how we do a better job of what was going on in the pandemic, and the methods that I would be suggesting would come up with an answer in 6 months or something, and the manager in the health service would say, actually, no, we can't wait for that. We need an answer next week because we're going to make a decision. So it was like, oh crap, all my clever research ideas actually won't deliver in the time that this person needs an answer. Another thing to consider is how much of a difference, how much of an improvement will actually be required to shift inertia and make change. I guess we start to get into sort of implementation ideas there. You might, for example, be aware of diffusion of innovation theory. Sometimes what we're doing is we're getting a result that's enough to pick for people who are really innovative and early adopters to change, but it's not enough to convince the people who are really skeptical to change. So is this an answerable question? Is it once you have the answer, what will happen? I think I just went backwards. So anyone want to have a go at using the ideas that we just talked about? Well, I talked about them. I'm talking at you guys. Anyone want to have a go at taking the question that they had and perhaps putting it in a Pico, writing something about the patient, the intervention, the comparison, and the outcome, or want to think through about have they specified it enough? Have they or add in some ideas about, is it actionable? If you can use the Slido, that's great. I will just see if I can have a look at the Q&A. And of course, if you don't feel like sharing this publicly, feel free to do it yourself on paper, just to give it a go. Thank you to the people who are typing. I'm looking forward to seeing what you have to say. So just as a reminder here, what I'm trying to encourage you to do is take the question, take the priority we're thinking about, seeing if you can specify it a bit more by adding in Pico kind of features. That's adding in something about the participant, the patient, the problem, the population, adding in something about the intervention and the comparison and what the outcome would be. Thinking about, is there anything about how actionable it is? I can see two people are typing. We'll just wait a little bit longer. One person's typing. Perhaps we can give it about half a minute more. Oh, here we go. Oh, here we go. Thanks, Katie. In the chat there's a reminder. And Katie's also put the the Kickstarter, the co-production Kickstarter in the chat there too as well, if you need to have a look at that. Ooh, I'm wondering if there's a technical issue here. We seem to have some people typing, but nothing's coming through. I might just leave it a little longer. We do have the chance to get to the end into a more open kind of discussion. This bit does look like it's becoming a rather boring presentation. So I think, oh, here we go. Can the staff shortage in AOD settings be minimized by intensive skills training, mentoring provided by the organization? Neat. That is really neat. Okay. Okay, so that's a very neat question, and it's definitely looks like it's going to be answerable. I suppose one thing you could think about is what's the comparison, because you're probably doing something already. And it might be that the research question is how much better, how many more staff could we retain if we did this intensive skills training mentoring compared with what we're doing already, for example. That might be might put a slight edge to that one. Thank you for that's a very neat way of saying it. I suppose the staff shortage aspect of it does seem to say both retention and recruitment. And it might be that you might want to think, is actually this a strategy? In order for mentoring and training to work, you actually have to have the people first. An outcome specification, it's actually perhaps about retaining staff rather than about recruiting them. On the other hand, it might be that your reputation as an agency that does good training. I know there's someone typing, and I apologize. I think we probably do need to move on. So I might, oh, here we go. Wow. Okay, so what you've got there as that one that's just come through is a very neat one. It's a much higher level priority than what we've been talking about so far. I think that's really admirable. Um, uh, and perhaps, as for the person who typed that in, that the methods that we're talking about might be appropriate within each of those service streams to come up with some priorities. Thank you for those. Okay, I'm going to go on now. What I wanted to do next was talk about prioritizing things. And I guess one of the things to think about up front is really whose priorities, who are the stakeholders? How do you decide when there's disagreement? Is it something that you want consensus on, or is it acceptable to average things out? And again, whose priorities, who are the stakeholders? One of the things that I love is and I think is a real strength in this space, is we really do not want to have yes people. We do not want to have people who are agreeable. We want to have people who are grumpy and unhappy, who are really prepared to tell us where we've stuffed up, so we can move forward. And I think I'm really very much appreciating the co-production Kickstarter and the wonderful work from Joe River and some of the others in that process. I've forgotten, I can't do justice to all the people in that team. So coming up with some sense of priority. Now, again, it's important to think about priorities because we're not going to be able to do it all. And we do have a restriction in the resources that we've got, and we might be better off doing a good job of one thing rather than doing a crappy job of a couple of different things. So that's worth considering. So I did want to point out that in amongst all this, there is a bit of research has a bit of a track record of being focused on individuals, but it is actually a team sport. And I think the kind of message here, particularly with co-production and co-design, is that in order to go further, you take more people with you, and you're going to make that progress. If you really just want to go somewhere fast, go on your own. So some of the ideas that I guess I'm expecting that there are some of you are members of the Dacron Consortium. Maybe some of you know about the Mental Health Australia General Clinical Trials Network, Magnet. These kind of bigger consortiums can help you to get, if there's an issue for you, it's unlikely that it's just your service. It's likely that it's going to be an issue for other services as well. So getting together, and that's one of the strengths of CumDone, is to get together and try to solve these things together. I would also put in a plug for open science. Too often we hide stuff, and to get research out into the open in an open and participatory way, I did put a little link in there for the open science framework. This is actually from a consortium of European universities really arguing for open science. So if we wanted to be absolutely aspirational, what would all this look like if it worked its way to the end? And one idea that I found really inspirational is this team of researchers led by Clara Lewis, who worked with a service, a drug and alcohol service for young people in Oregon. I think it was the Wolverine service. And they came up with this really deep, long-term collaboration that progressed things over years. There was a lot of time in this, and it was resource intensive, but I think as an example of how good it can get, this idea of a tailored implementation blueprint is very neat. I think realistically, we're not going to get all of those features in place, but knowing there's something that we can aspire to might be helpful. So that brings me to the end of the slides, and we want to jump into some more discussion. But at this point, I wonder if you could share with me and give me a bit of feedback. What are the ideas that you're taking away from the presentation so far? And then I think we can move into a more open discussion. Thank you to the 17 people who are the stayers. We did lose a couple of people along the way. Trip is handy. Yeah, I think the trip database is really useful. I find that very useful because it does, for quick answers to things, a sort of horizon scan. I think that's really useful. Pico is certainly one way to kind of get that research question a bit more refined. Some resources to go away with and explore in more detail. That's it. Yeah, and I think that's a good point about a systematic process in developing research questions. You often get the idea that research is about sort of some crusty old white dude sitting in a room by themselves, having inspiration, scratching his bum, maybe. Perhaps I could leave that bit out. Maybe have to edit that out of the recording. When in fact, it comes perhaps, particularly when we've got really pressing needs that we need answers to, it's probably useful to have a more structured process. It's not just some dude thinking of inspiration. It's actually a careful process that brings us to this. Yeah, choosing something achievable and timely. Okay, thank you. So there's one more person typing. I might just wait till they come through. Right. Relevant to your organization. I think you're the only ones who can know what's relevant to your organization. That knowledge is power. Cool, there's some really good feedback there. Thank you. Okay, so what have I got next? Or start with uncertainty. Yeah, pay attention to uncertainty. Thank you. So what have I got next? Okay, there's a reference to quite a nice priority process that Alison Ritter and some others were involved in that you might want to have a look at. Some of what we're talking about fits into what's broadly called implementation science, and Sydney Health Partners does have a nice online community of practice with a resources hub. This is really about how do we help research to be translated into practice. So it might be useful to join up on there if you're interested. That's how you get in contact with me. And I think at this point, I might have run out of slides. I'm going to stop sharing, and I guess we get some more open discussion time. So we can use the Q&A section to do that. Katie, how would you prefer us to do this?
Yeah, happy for people to please ask your Q&A, or you're welcome to jump in the chat box as well. Maybe I'll kick off to get the ball rolling, and maybe it's a question that's on some of the attendees' minds, which is, I've got these ideas, but it is the barrier of resources and time. So what would be your biggest advice to kind of helping mitigate that?
Yeah, and I think the research is team sport is probably the best advice there. I do sometimes I bump into people who say, oh, it's my ideas, I don't want to share them with anybody because they're going to pinch them. And I guess I have definitely come across people who do pinch ideas. More often I've come across people like myself who have 20 ideas a day, and only one of those ideas survives the week. And so I'm not really interested in pinching anyone else's ideas. Getting in contact with other people, sharing and discussing it can often really help to get around that, because if it's an issue for you, it's likely to be an issue for your colleagues. I do feel like there are partnerships with researchers are really valuable things when they work, and some of the ideas that I think one of the big things I've been trying to say is that to have a really good partnership with a bunch of researchers, knowing what you need to know is a good idea to help you start that partnership or improve that partnership. And in amongst all of that sort of thing, One of the things we've often done in the university is use student research projects as a way of building capacity. That's not an easy, simple solution because students actually have to work to a particular timeline, and that timeline doesn't always match the kind of timelines and expectations that are there in the service on the ground, but it can work sometimes.
No, that's a great idea. And I think that idea of sitting in the uncertainty is something that I will definitely be taking away from today, and hope that some of the attendees will be too.
Oh, there's a comment about mentioning the rec, which I think
Yeah.
is from Corinne, which is I think a really good point. This is one of the really wonderful things about ComDown is the resources that are there to help members of the network to get research. But I'm answering the question. You should, Katie.
No, go ahead. So Andrew is actually one of our members of our research ethics consultation committee, and it's an informal committee. It's not like going through a HREC, and it's about being able to spitball ideas. You can put through your existing projects. You can submit ideas to put forward to HREC for just to as a source of reflection of where you're currently at. And it's from an unbiased group of people that just have a passion for research in this area. And it's free, it's easily accessible through the ComDown website. I can pop a link in through the chat as well. As well as I can include it in the follow-up email. And another option as well is the Matilda Centre have a great mentoring program as well, which is the information is through the Matilda Centre website, or we've got it available on the ComDown website as well, which helps. Yeah, you can go trying to figure out your research questions. They can help really develop that, or just building that capacity and having someone to spitball your ideas with as well. We also have a program logic resource, which is new too, which is another way of, I guess, Andrew was talking about looking at the end result to see whether or not it's actionable, which those program logic frameworks are a great way to really map out and see, go from, I guess, the end and backwards to say, I want this outcome. Let's work backwards to see what question we would need to answer to get there. So that's another way to really nut out and look at those gaps. If you've got an idea that you're going, this is what I want to see less people coming with this problem, and then working really systematically backwards. And it's as easy as you can do that in a group supervision with your team, or you could do it as a consultation with stakeholders. So that's another great way of trying to answer these questions. And I think a few people in the chat have heard.
And Sue's asked a question about, it's often said that the question is leading the research toward a specific answer. What are your thoughts? And I think what often happens is that it helps people to have a specific question to start with, but then the world is very instructive. And usually when you've got the answer, you discover that actually you needed to know a whole lot of other different things, so you go on to the next thing. It's that process, I suppose, of, it does sound like your concern, Sue, is that you're sort of narrowing things down prematurely. And I think that it's a valid thing to think through. Have you missed something along the way? By reflecting on the answers you've got, which are, I guess, using the analogy from Douglas Adams, 42, well, that's the answer to everything. And you go, well, come on, there's something wrong there, because that's not very useful. Well, what have we missed along the way? And so by going through the process and doing it in a just, I guess, a continuous plan, see, do cycle, maybe, is one way to think about it, as a continuing process that by having a go at it, you end up with another set of questions to ask. And in some ways, that's the fun bit, or at least for people like me who are professional researchers, that's the bit that I find fun, is we're on this ongoing process of testing ideas out.
Yeah. Well, look, we have hit 3 o'clock. So if anybody has any questions, please feel free to email me through the ComDown email and I can get those through to Andrew. But thank you all so much for attending, and a big thank you to Professor Andrew Baillie for facilitating today. I think it was so great to see people engaged through the Slido mechanism, and yeah, I think it's a really awesome thing for the ComDown membership to have at their disposal, which will be, so the recording will be uploaded to the ComDown website in a couple of days, and I'll send through a little evaluation, maybe along with the slides as well, just so that you can go back and get access to those resources and see Pico and Trip in your own time. So thank you, Andrew. Yes.
I've only got one thing, and I did actually promise it in the process, and that is that some of the things you asked in the Slido we weren't going to cover, but maybe Katie and I can have a chat about those and see if there's things we can get out to you about or asked that we didn't answer.
Yeah, absolutely, absolutely. So thank you all, and hope to see you again soon in another ComDown event. Have a great afternoon.